For the last year and a half, the state has been trying a new approach with mothers whose newborns are exposed to or born addicted to drugs. News 13's Rachel Knapp is live in the studio tonight to explain.
Dean, these are mothers who suffer from drug use, and the new program is focused on getting these mothers treatment instead of getting them in trouble. The Comprehensive Recovery and Addiction Act, better known as KRQE, is a relatively new state program. When healthcare workers discover a baby has been exposed or addicted to drugs, they alert CYFD. Under the new law, a mother's use of drugs alone isn't a reason to file a child neglect or abuse case with CYFD. In these cases, instead of punishment, CYFD now offers help.
We sit down, we talk with someone and say, here's what we have that we can offer to help you, do these. What would you like?
Before the mom leaves the hospital with her newborn, she has to fill out a care plan. It allows the mom to select services she would like for her and the baby, like home visiting, infant mental health, substance abuse counseling, and even transportation help. But here's the catch. The moms aren't required to do any of these programs.
In theory, the program is a great idea to support these families and help the children stay in the home.
State Representative Rebecca Dow has concerns about the program being voluntary and wants to see more data on how many women are actually using these services.
If families aren't engaging, then taxpayer dollars are not being spent effectively. If families aren't engaging, then risky behavior isn't being reduced.
Officials say it's still too early to see which services have been the most effective, but believe the new approach is making a difference.
In the year and a half we've been working, we've seen some of those early families who have been very successful with our program.
CYFD explains to me that they keep track of the mothers in the program, and if a mom misses an appointment or a counseling session, their care coordinator will try to contact them. Dean.
All right, Rachel, thank you. We're told the most common substances found in these newborns are meth and marijuana.